Hello, good afternoon. Today we're going to be demonstrating the proper technique for a venipuncture. And before we actually perform or demonstrate the venipuncture, there's going to be a few things that we need to make sure that we have on hand. First of all, of course, we do need a patient. Second thing is the patient's medical chart. You should always have a medical chart on hand with you just to make sure that you're actually performing the right procedure on the right patient. Verify the orders in the chart that should be coming from the physician. You should document what procedure or what lab tests are going to be run. Another thing, we need to make sure that we actually have a requisition form filled out correctly and marked what procedures are going to be done. Before we actually start, I will show you guys the supplies that we're going to be needing. So now we're going to take time at this moment. We're going to look at the supplies. Okay, we're pointing out our supplies that we're going to be needing. Always, it's going to be personal protective equipment, which is your PPE. We'll start with your gloves that are right here. We also need a personal protective equipment for your face, so it's going to be a shield, face mask right here. And our other supplies will include your vacuum tubes, and today we're going to be doing a chemistry test and a lavender test. 2 tubes, but if you guys notice, we have 2 other additional tubes, and those are just in case if we actually lose suction of the vein during the procedure. We have 2 other tubes on hand. We have our Band-Aid in place. We have our tourniquet as well, our needle, which is a 22 gauge by 1 inch, vacuum holder or the hub, and we have 2x2 gauze and our 2x2 alcohol prep pads. You guys notice on the right hand side we have a biohazard specimen bag, and that's for transportation of the vacuum tubes. Alright, what we're going to do, we're going to make sure we have our personal protective equipment on. We have our gloves. As you can tell, I do have my lab jacket on hand. Make sure we wear our exam gloves. And we're going to protect our face as well. Okay. And before we actually do the actual procedure, what I'm going to do is I'm going to palpate for a vein, and what that means is we're going to actually locate a vein. You don't mind making a fist and put that under there. Looks like we've collected. There we go, just like this. And we palpate. And we're going to clean this area just a bit. We're going to clean this area, starting in the center, working your way out. Okay? You never want to come back in the center. You don't want to recontaminate that area. We're going to allow that to dry for a few minutes. And while that's drying, we're going to be connecting our needle to the hub, putting our tube. I like having my tube already set in there. Once again, tourniquet nice and tight, and the tourniquet should be about 1 inch to 3 inches above the antecubital fossa. You guys notice all my supplies are on my right hand side, so my free hand will be my right hand. So what we're going to do, the label will go down and the bevel will face up, make a tight fist. What we're going to do is just kind of taunt the skin just a bit, and let your patient, they're going to feel a little stick. Okay, insert the tube just like this. As you can see, blood is filling in the tube. Once it's full, remove the tube, inverted 3 to 5 times. Without looking away at the needle, grab one other tube, which is for your complete blood count or hematology. Collecting your tube. We are 3/4 full. Remove the tourniquet just like this. Relax your hand and remove the tube. And once again, invert your tube 3 to 5 times. And we're going to use our 2x2 by putting a little pressure. If you don't mind, elevate and apply pressure. Our needle will be disposed in the biohazard container. And during this time, we're going to be asking the patient to continue to elevate, and we're going to label the tubes, patient's first name, patient's last name, today's date, which is 6/20 of 2011, and we also want to put the time that we actually drew the blood. So it's about 3:15 p.m. and we're going to put our initials on that as well. Once you have labeled both tubes, lay these down. Now we can take care of our patient, and we're going to put a band-aid on the area that we punctured. And all right, well, that's going to be it. You can check out up front. That's the proper technique for doing a venipuncture.